Hi, everyone. My name is Dr. Jennifer Jackson. I'm a registered nurse and assistant professor in the Faculty of Nursing at the University of Calgary. And this video is about quantitative research designs. So we're going to provide an overview of quantitative research and talk about the basic principles of quantitative research that are applied in nursing. So what we're going to cover today, I'm going to do this section in two parts. The first part is we're going to talk about principles of quantitative research that apply generally to all studies. And then we're going to look at specific different types of designs and how they can apply to different specific examples. So we're thinking about different kinds of research and how we can apply it clinically and how we can also assess whether this research is good, not good, safe to use, or whether we need more evidence before we start making changes in practice. So we're going to kick off with a brief overview of quantitative and qualitative research. So when we look at how research is done, we can basically break it into two families of work. So quantitative and qualitative. Now, like everything, real life is complicated and there's overlap between the two. Many people use what's called mixed methods or multi-method studies, which is where you have a bit of both included. So there's not always a very strict, clear line between the two. But for the purposes of explanation, I'll talk through the kind of the main differences and know that we're focusing on quantitative work then in this video. So qualitative and quantitative are two broad categories that have different approaches to understanding research. So with quantitative research, we are looking primarily at statistics are involved. That's one of the main differentiating factors for quantitative research is that statistical analysis is included. So it tends to be deductive. So we come up with a question or a hypothesis, and then we do tests to assess whether our hypothesis is correct or to answer our question. So it has very much of a kind of responding sort of framework. So we start with a question, do some tests, and then respond to that question. So when you do a study, you have a pretty clear idea of the direction you are going to go, and you use numerical testing and a very structured design in order to test that hypothesis or answer that research question. So it can involve studying something as it naturally occurs, or you can do experiments, which is where you control the context to try and identify a specific factor that may or may not contribute to an outcome. So what I mean by that is when we are looking at what if we give population A new medication and compare it with population B who are getting standard treatment. In that type of study, we are controlling the context. So we're controlling what type of medication people are getting. So in that sense, we're going to test whether that medication is effective by looking at the outcome. We generally do quantitative studies with large groups of people, and we want those people to be randomly chosen so that from the quantitative research, we can extrapolate to what might be happening at a population level or across a larger cohort. So in contrast, qualitative research is no less rigorous, but it answers different kinds of questions. So with qualitative research, you're not testing hypotheses. You are asking broad questions to explore ideas or look for new understanding about a topic. So rather than using statistical analysis, usually qualitative research is based on understanding people's experiences, their perspectives, and processes they went through. So instead of doing things like surveys or looking at chart reviews or testing, different scores to compare how effectively drugs work or medications work, in qualitative research, you ask open-ended questions and you don't really know where you're going to go. So rather than say, is medication A superior to standard care, you might say, what are the experiences of people who are receiving treatment for male breast cancer or something like that. They tend to be quite small studies, and the idea is not to apply to a whole population. The idea is just to understand a unique experience in great depth. So you tend to have smaller numbers of people. So a quantitative study can be in the thousands. A qualitative study might be 10 to 20 people. We have on here also that qualitative research is subjective and quantitative research is objective. That is open for discussion. I think it's generally acknowledged now, all research comes with a degree of bias or a degree of subjectivity. So sometimes people think, oh, well, we're doing, kind of mathematical equations. We're taking the human element out of it, and it's just completely neutral in terms of values or ethics, and that is not true. So we know that based on what tests you use, based on what populations you work with, based on who has access to the intervention, all of those things can reflect researcher bias. So the idea that quantitative research is free from the influence of humans and is completely objective and standard is not really a useful perspective, especially in healthcare where our work is very applied. So you can maybe make more of an objective argument if you're looking at cells in a petri dish, which is really important, but that's generally not what NERBS researchers are doing. We're looking at humans out in the world and how we can support them. And when we work with humans, work is inherently complicated, complex, a little bit messy, because that's how humans are. That's true for all of us. So I've left that on here, but I would encourage you to look beyond quantitative or qualitative in terms of objectivity. The other thing is that a lot of researchers in broader medical communities tend to view quantitative research as superior to qualitative research, because they see that when we can apply to large populations, that is actually useful, whereas quantitative research can be very niche and that kind of thing. I don't agree with those views at all, and I encourage people not to buy into that, because qualitative research can tell stories and give space for people to share experiences that may not fit the mainstream population and might be overlooked or unheard or deliberately ignored in other contexts. Plus, the reality is we need both. For modern healthcare, we need both types of research, and one isn't better than another. So we can look and say, is medication A superior to medication B? And it might be superior, but if the experience of taking that medication is awful, then maybe that's not the thing that we want to offer to patients. Or maybe people who are racialized are experiencing more difficulty accessing medication A. And so what does that mean for when we're providing healthcare? So just to say, there's two general kind of groups of research studies, and I would argue strongly that they're both essential for applied clinical work. And while they have different approaches, we need both when we are providing patient care. So how do we know if we want to do a quantitative study? With any research, we want to look at what is the problem we are trying to solve, what is the question we are trying to answer, or in some cases, what is the hypothesis that we want to test. So we start with the big idea, and then we look at what is the best way of addressing that big idea. So we always should start with the idea rather than the method. Sometimes people say, hey, I want to try this really cool approach to research, and then kind of map backwards and forwards from that. It does happen sometimes, but it's generally not the best approach. In theory, you want to start with your idea and what you're going to do from there. There's questions of what is the best way to answer this question, but also everything with science is complicated and messy, and sometimes it's a question of what is the most feasible way to answer a question. So we might see that one approach would give us like a superior sort of scientific result, but it's going to take 5 years and cost $3 million. Whereas a second approach might take a year and be, $30,000. And even if the degree of statistical certainty is not as high, there can be pragmatic decisions for why you do a study a different way. So you want to do a quantitative study if you are trying to compare one thing with another, if you are trying to test a hypothesis, or if you're trying to look at anything happening with a population. So either change in a population over time, how different pieces of a population or different segments, if you will, experience a phenomenon, or if you want to look at the impact of an intervention or the impact of an experiment and see how that changes outcomes. So those are the types of questions you want to do with a quantitative study. If you want to understand people's experiences or culture, that falls more in the remit of qualitative research. So building on what I was indicating, quantitative research, we're testing interventions and treatments. Does medication A produce superior outcomes to medication B? Does using a flipped classroom approach like this in nursing education result in higher levels of student information retention than a traditional didactic approach? We can look at testing between two groups. We can say, what are the outcomes of taking this medication for men versus what are the outcomes for women versus what are the outcomes for non-binary people or people with diverse gender identities. And by looking at different groups, we can say, okay, what do we need to understand about how we provide care? Maybe men are having fewer side effects than women. So what do we need to know about women's biology, physiology to maybe adjust the medication or adjust the dosing for that group? And then again, how does that contrast with people with diverse gender identities? What are their outcomes with this medication? Do they need a different dose? Do they need different considerations with prescribing? We can also look at the relationship between two or more variables, and this can be very theoretically driven. So maybe we want to say, does having an increase in help-seeking behavior promote individual resilience? So we would go into the study perhaps with an idea that people who are more likely to seek help are going to report higher levels of resilience. And so we test whether those relationships actually hold up when we're doing a statistical analysis. We can look at populations over time and changes of populations over time. So those types of studies might be, what are the number of people with COVID-19 across Canada, across the United Kingdom, and how did that unfold over, month by month, week by week, and we can look at how that change occurs over time. We can also look at how different populations engage with phenomena. So looking at who smokes more, men or women or people with diverse gender identities. Which racialized groups are experiencing higher rates of heart disease. So we can try and look at different patterns that are happening in our populations. And that can help us set up to say, okay, if we are seeing that people who identify as Indigenous have higher rates of heart disease than non-Indigenous Canadians. What could we do with that community to try and create interventions to decrease heart disease in that population? So those are some examples of the types of questions we can ask with quantitative research and how we might approach looking at different factors. So speaking of different factors, one of the main considerations in quantitative research is the type of variables. So within a broad type or broad list of quantitative studies, so regardless of which variety of quantitative research you're using, you're going to be talking about different types of variables. So the independent variable is the one that we can control, and we try to get an outcome. So if our study is, does a flipped classroom approach enhance nursing education and result in higher student grades? So our independent variable, the one that we can control, is using the flipped classroom approach. In contrast, our dependent variable is the outcome. So the higher student grades in this example would be the dependent variable. So we talk about independent and dependent variables because if you're creating a quantitative hypothesis, you almost always want to show a direction in your hypothesis. So I say that higher student or the flipped classroom approach results in higher student grades. That makes sense. It makes less sense to say, well, higher student grades result in professors using the flipped classroom approach with increased frequency. That we're kind of getting into to use a chicken and an egg kind of idea. So you want to be clear about, we think A connects with B. And so your independent variable connects with your dependent variable. So within a study, when you're appraising quantitative research, you should be able to identify these variables, and there may be more than one. So we could say, does the flipped classroom approach, as our independent variable, does it result in higher student grades, but also increased collaboration amongst colleagues? So we can have two dependent variables, you can have more than two, but you want to be able to understand and look at a study and say, where's the independent variable, where's the dependent variable? If you can't do that, we're in trouble. So that is a really good red flag that this research is maybe not going in a good direction. The other factor is that there are confounding variables. So confounding variables are things that might also impact that relationship. So we might find that using our example of, does a flipped classroom approach result in higher student grades? A confounding variable might be whether students have a prior degree before coming into nursing, or if they are direct entry from their secondary education. So if you've just started nursing after grade 12, maybe you have different approaches and experience with learning in classroom environments than if you've already done a university degree and nursing is your second degree. So if we, in that case, we could have an independent variable of flipped classroom education, dependent variable of increased student grades, but a confounding variable that might influence our connection between the independent and dependent variable could be the experience that someone's had with different styles of education based on whether they have a prior degree or not. So this is important because with quantitative research, we're trying to identify associations between A and B. And so if that relationship between A and B is impacted by other factors, we need to keep that in mind. So how we look at these variables is by controlling the context of the study. So in this case, with our independent variable, we would probably say we're going to offer students in one section a flipped classroom approach, and students in another section of the same course are going to get regular didactic teaching. and then look at the student grades as the outcome. In that case, we are controlling the context. So we are controlling which groups get that intervention. And it's by controlling the context that then we can say, yes, one is associated with higher grades or one is associated with lower grades. That element of controlling the context is critically important in quantitative research, because that is what separates a lot of quantitative research from qualitative research or other types of approaches. So if we truly want to understand what is happening between our independent and dependent variable, we need to try and create conditions so that we can actually detect the impact that is having. So if we just had a bit of a free-for-all and educators could use flipped classroom or not, or they could participate in the study or not, and everything, you know, we had no idea what styles of education students were actually receiving, then there's no way to say, okay, well, we know that A led to B. So that's why we try and control the context and say, okay, this section is getting one approach and this section is getting the other approach. So you'll see that that emphasis on managing context is really important with this type of research. So when you're creating a hypothesis, you want to lay out or these types of variables. So say we predict there will be a relationship among variables A, B, and C. A hypothesis can be directional. So that means that a direction of the hypothesis is implied. So flipped classroom leads to increased student grades. You can also have a non-directional hypothesis. So maybe resilience is associated with higher levels of social contact among students. So we're not necessarily sure whether higher resilience leads to higher social contact or if higher social contact leads to resilience. We don't know quite which way those concepts connect, but we're going to test to see. You can also have something that's called a null hypothesis, and this is the counterpoint to your directional or non-directional hypothesis. So your directional hypothesis could be flipped classroom models lead to higher student grades. The null hypothesis is flipped classroom models have no impact on student grades. So the null hypothesis is a whole discussion in and of itself, but just to say that in this context, it offers a counterpoint. So there is an impact here, there is no impact. At the end of your study, you can say that you either accept the null hypothesis, so there is no impact, or you reject the null hypothesis and instead accept your original hypothesis that yes, there is an impact here. So that is a little bit complicated, and I encourage you, if a null hypothesis is something you want to get into more, that's maybe a place for additional reading, because I don't want to get too far into the statistical content here, because we're aiming for a broad overview. But just to say that you can have a hypothesis that has a direction or not, or is the null hypothesis or the counterpoint. And a hypothesis is consistent of different types of variables, and the variables explain the type of relationship you expect to see with your research. So another factor to consider is the type of measurement. And so when you're looking at a variable, you can have variables that are measured in different ways. So this, again, we're in slightly complicated territory here, but I'm going to provide a brief overview so that we can think about the types of testing statistically that we do in quantitative research. So our types of measurement are nominal, ordinal, or ratio. There is more nuance and some other arguments of different kinds, but we're going to stick with the the main priority here. So nominal variables, a nominal measurement, just as it implies, is based on the name. So nominal are categories that are different by name, but not by value. So gender is a perfect example of a nominal category. You can have men, women, diverse gender identities, non-binary, and each of those groups is equivalent of value to the other groups. So one is not better than another, and you can use that type of measurement to look at different demographic categories across the population. So you may see other nominal variables are country of origin, racial or ethnic identity, and other things that you can name. So a nominal variable, there's no value difference between the different categories. In an ordinal variable, there is a value difference between different categories, but that difference is not necessarily equal. So a classic example of that is when we look at average household income. So knowing that socioeconomic status is one of the most important factors in the world for health, there's lots of studies that look at what is your annual household income as a proxy to assess socioeconomic status. So with an ordinal variable, we might have categories like under $50,000, $50,000 to $75,000, $75,000 to $100,000, or $100,000 plus per year. Now, in using that type of approach, our first category would be 0 to 50, then we have 50 to 75, 75 to 100, and 100 and above. So the difference between 50 to 75 might be very different than the difference between 100 and above. So there are numerical differences between the categories, but those differences are not necessarily equal. So in this example, this would be a really good place where we would expect an ordinal variable to be theoretically driven. So that is to say, maybe under $50,000 indicates people living in poverty. And then maybe we know that $50,000 to $75,000 is, we expect kind of people there to be at risk. And then $75,000 to $100,000, we should start to see positive benefits from being in that income range. And beyond $100,000, you know, it doesn't matter if you're at 100,000 or 250,000 or $1 million, you're in a category where there's lower health risk for you. So we can use what we know from other studies to decide where do we put the borders on those kinds of categories. Our third type of measurement is ratio measurement, and that's where there is a numerical difference between different categories, but that numerical difference is equal. So the classic example is money. $2 is double $1. Then we have $3, $4. The difference in increments between each of those pieces is the same. Another classic example is looking at temperature. So 4 degrees, 5 degrees, 6 degrees, those are all separated by the same amount. So it allows for a very precise degree of measurement. So theoretically, you want to move towards ratio level measurement because it is more precise. However, you cannot have a ratio level of gender. You cannot have a ratio level of, of country of origin. So based on what types of variables you want to include, you look at what is the most appropriate way to create that type of variable, or what is the most precise way to measure that variable. And then based on that, you look at what statistical tests are appropriate. So within this, you can also have, you'll see in quite a few studies, you'll have a validated tool or a validated scale. This again is a place for some additional reading, but in really brief, That is where you've got a scale where you take a combination of questions and you usually come out with a ratio level measurement. So quality of life is the classic example. If you ask someone, say, 20 questions from a validated quality of life questionnaire, you might get a number at the end. And so the combination of questions gives you a ratio level variable. So researchers love using these because they're really precise, and it provides an opportunity to test across large groups and populations. So there are tens, maybe hundreds, but at least tens of measurements of quality of life. So you can compare quality of life in China with quality of life in Mexico. And we know that these tools are valid and reliable, and so they provide a high degree of measurement or a high degree of precision in the measurement. So validity and reliability are things that we're going to touch on in our appraisal videos. But in general, it means we trust this measurement and we know that we're measuring what we want to measure, and we trust that it is a good way to do statistical analysis. So from there, when we get to statistics, so we're looking at what are our variables, what types of measurement are each of these variables, and then that leads us to what types of statistics can we do. So statistics, people can have a complicated relationship with statistics. Some people think that it's great because it provides a high degree of precision in the analysis, and you can very clearly see, you know, A is higher than B. Other people look at it and they just see math soup and they get really intimidated. So I would say whichever group you're in, try and embrace the statistical tests, and don't feel like it's something you have to understand every single element of to see value with. So there are entire university courses about statistics, and I'm not going to try and replicate that here. Rather, I'm going to talk about how, and this is within the textbook, goes into more detail, but the tests you can conduct, the statistical tests and the statistical analysis that you can conduct are based on what are your variables and what are your types or levels of measurement. So for example, or sorry, before we go there, so we have descriptive and inferential statistics. So descriptive describes. A classic example of descriptive statistics, and this should be table 1 in every study you ever look at, whether it's quantitative or qualitative. Descriptive statistics describe what is happening. So you want to describe your sample. So in this sample, the average age of nurses who participated was 45 years old. In this sample, 90% of participants self-identified as women. In this sample, we had 40% of participants identified as white, 30% identified as Black or brown, and the remaining percentage identified as other racial groups, which are spelled out in more detail. So the descriptive statistics don't try and they don't try to come up with answers about causation. What they do is try to tell you what group you're working with and who is in this group and what are the basic scores of whatever test you've done. This is really important because in quantitative research, one of our aims is to generalize our findings. So you need to say, what does the sample of this study look like? And is that similar to the population that I might be working with? So often in nursing samples, nursing internationally is around 90% of people who identify as women. So we know that in a nursing sample, almost any study in the world, you're going to have 90% women. So if you have a sample that is perhaps 40% women, depending on what variable you're looking at for your dependent variable, that study, the results of that study might apply less broadly because of the gender differences in the sample. So that is how descriptive statistics tell you, how can I apply this, or how can I use this information? The flip side is inferential statistics, and this is where we're not just explaining what is, we're looking at, does our intervention create the outcome in our dependent variable that we want? So you're creating an inference, or you're testing an inference in inferential statistics. This is a great workout to make sure I've got all of my elocution going and my pronunciation going this morning. So inferential statistics are things like regression analysis, correlation analysis, cross tabulations. There's many resources that can go into each of those in more detail, but basically the inferential statistics is where you answer your research question. So they can tell you, did people who participated in flipped classroom have higher grades? So descriptive statistics describe your sample or describe kind of the status quo. Inferential statistics can help answer the research question. So when we're looking at appraising a research article that has statistical tests, what you want to do is look for a few key things. Regardless of the design or the method of the study, there's a few things that you need to look for. So you want to check out many textbooks and online, I'm sure you can find tables that show if you have a ratio level independent variable and you have a ratio level dependent variable, you can conduct a correlation. So when you're looking at a quantitative paper, you want to say, what is the independent variable? What level of measurement or what type of measurement do I see there? Then look at the dependent variable, or the independent and the dependent variable. What type of measurement, and based on that, what kind of statistical test could I use? So if somebody has two nominal level variables and they're trying to do a correlation, you know you're in trouble because you can't do that with those things. So identify which variables you're looking at, what is the level of measurement, and then what are appropriate statistical tests that you could see for those types of measurement. So with that, then you want to look at, okay, are the tests appropriate in the first place? From there, have they used all the variables in the analysis, and have the authors shown you all the results? So this is one of the classic tricks of quantitative research, is they don't report all these data, or you see what's called cherry picking. So they'll report a little bit of this and not that. This is one of the most classic red flags when you're appraising a quantitative paper. So if it says that they did a correlation in the methods, you should see a correlation table in the results. If it says that they did an ANOVA in the methods, you should see an ANOVA table in the results. Even if you don't know what an ANOVA is, with a great degree of confidence. If it says ANOVA in the methods, there should be an ANOVA table in the results. If there's not, we're starting to get nervous, because then the authors maybe have only shown the really interesting results and not all the other results that said, actually, there's no difference in flipped classroom at all, and your study didn't find anything. So the other thing is, if they do, and then so you should see a table for each kind of test. And then if they did an analysis such as a regression being a specific type of test where you can figure out what percentage of a phenomenon is caused by something. So maybe in our case with the flipped classroom and the increased grades, we could say at the end, the flipped classroom was responsible for 30% of the outcome of increased grades. So the other 70% was based on other things that we didn't detect in this analysis. So if you see a regression analysis, you would also expect to see all the variables that the authors have identified in that regression, or an explanation saying we left these variables out. That can be really, that's another place where it can be shady. You might see they've run a regression with several steps, and so over the course of doing those steps, they took out the variables that weren't influential, but that should all be clearly explained. So you want to be able to see, these are the variables, these are the levels of measurement, these are the tests, these are the results of all the tests. So you can walk through quite systematically, are all of those things there? And if you don't see them, you're nervous. Because some authors like to kind of sweep some data under the rug if they're less interesting or less likely to get them the promotion at work. So that is why you have to look for all data being reported, not only the kind of sexy ones. Again, in brief, another thing you'll see is p-values. So you could do an entire lecture on a p-value, but I'll just talk briefly about how a p-value demonstrates the percentage of likelihood that something is due to chance. So we measure whether, do we think that flipped classrooms truly improve student grades, or was this a fluke? So p-value can tell us what percentage of likelihood is it that there's a fluke. So generally a p-value to be statistically significant is at 0.05. So that means there is a 5% chance that this was a fluke. And if you see a p-value that is less than 0.05, it means there's less than 5% chance that this is a fluke. So the smaller the p-value, the more we trust the outcome of the experiment or the outcome of the analysis. So when you see p-values that are higher, we say they are not statistically significant. Now, where people can get tripped up is they say, oh, this was more significant than that. Or because this p-value is higher or lower, then that means that the impact was higher or lower. That isn't the case. A p-value is a pass-fail measure. It's either statistically significant or it's not. So you might have something that's, p is less than 0.000001. That means that there is almost no chance that this is a fluke, but it does not mean that we had a really strong effect. So just important to remember, a p-value is a pass-fail measure. Is it due to chance or is it not? And then based on that, then we look at the other statistics we have, such as the effect size, to see, we might know that it's not due to chance, but it actually has a very small outcome. So try and keep those things separate. I see often that people can get the wires crossed with that. So just to know that p-values don't tell you how much impact your intervention had. They just tell you whether it's due to chance or not. And again, I can refer you to lots of other reading to look at these tests in more detail. So I'm going to stop there for part 1. So this has been an introduction to broad concepts in quantitative research. And then in part 2, we're going to look at specific different designs and how those apply to research studies. All right, thank you.